City officials in Montreal have voted to stop adding fluoride to tap water in several suburbs on the city's West Island. Montreal's water department made the recommendation earlier this year, but mayors of the affected suburbs say they only learned of the city's plan in September. They say residents weren't consulted. Officials have cited cost, safety concerns for workers, and a lack of consensus over fluoride's health effects as reasons for the move. The rest of Montreal has never had fluoride in its tap water. To talk more about this decision and fluoride's benefits and potential concerns, I want to bring in Paul Allison. He is a professor of the Faculty of Dental Medicine and Oral Health Sciences at McGill University in Montreal, and appreciate you taking the time. Thank you.
Thank you.
So first off, what is fluoride? Tell us a little bit more about what it is and maybe its benefits.
Well, fluoride is an element that we use very widely and has been used for many decades now to help prevent dental decay. It can be put into the water supply, but it's also in most toothpastes. It can be in mouthwash, and if you go to the dentist, it's in the form of varnish or gel. And all of these forms of fluoride that are applied to teeth have been shown to be highly effective in reducing dental decay.
Okay, so let's talk a little bit about that, because the question is fluoride in water. What are the benefits of fluoride in water versus not having fluoride in water?
Well, the big benefit of putting fluoride in water is that everyone gets water, everyone drinks water, therefore everyone's going to get fluoride. The other forms of fluoride that I've just described mean that somebody has to buy the toothpaste, they then have to clean their teeth with the toothpaste, or they have to be able to go to the dentist, take the time to go to the dentist, afford to go to the dentist. And the problem is dental decay is extremely common. It's the most common non-communicable disease in the world, and it's very, very common in Canada. It's the most common reason for young kids to have to be put to sleep, to have teeth extracted because of dental decay. So it's very, very common, and it's far more common in those parts of the community that often can't afford to go and see the dentist, maybe not even be able to afford to buy toothpaste. And so that's a way of getting fluoride to those kids and adults who are at highest risk for dental decay.
So why would you not put it in the water? Or, you know, what are some of the reasons, do you think, for the City of Montreal making this move so that it doesn't go into the water of some of the West Island suburbs?
Well, some of the arguments can be based on, the concept that we're putting something into the water to help prevent something, and lots of people don't like that idea. I would say, well, we put things like chlorine into the water to keep it clean, to kill the bugs in the water. So this is just another thing. We put things in the water, make sure it's safe for us. So that's an argument. And then there have been other arguments presented, because there are a few studies, very few studies, which suggest health effects on different elements of our body. So, but that goes against the vast array of research that shows the beneficial effects of fluoride. When we look at research, which suggests, for instance, there's a study that recently came out suggesting the possibility of an effect on IQ of infants. That's one study that's been done. Mm-hmm. And in the world of science, we need to do multiple studies to see if we find this again. This hasn't been found again, whereas, again, multiple studies have shown the beneficial effects of fluoride.
I mean, we can't avoid the kind of political discussion that's going on, and we have RFK Jr., who is could become a key person in the Donald Trump administration in the United States. I know that's in the United States, but it seems to be having, and he doesn't like the idea of fluoride in water, right? And he seems to be having an impact on what's going on in Montreal.
Well, apparently, yes. I mean, I can't comment. I mean, you know, I think we all recognize social media and what's said on social media is beyond, anyone's control, and so people can say what they like, and people will believe whatever they read in social media. Speaking as a scientist, I try to be much more rely on the research that's been done and the quality of the research. And we as scientists have to be better at getting our message out through social media. But that's the reality of the world at the moment. There are lots of people who are trying to push all sorts of ideas through those means.
Paul, thank you. Paul Allison, he is a professor in the Faculty of Dental Medicine and Oral Health Sciences at McGill University, and we reached him in Montreal.